Hey, Book Podcaster crew, and a really big, warm welcome, especially to all you fantastic nursing students joining us today.
It's great to have you here.
We know nursing school reading can be, well, a lot. Sometimes those textbooks feel like they weigh a ton, right?
Definitely. It's a huge amount of information to absorb.
But hey, that's why we're here. Welcome to the deep dive. We're here to help you sift through the important stuff, grab the key ideas, and hopefully make it feel a little less overwhelming, maybe even a bit fun.
That's the plan. Think of this as your focused guide to really understanding some core concepts you'll definitely need, both for exams and, for your actual practice later on.
Exactly. And today we're diving into something super important in psychiatric mental health nursing, milieu therapy, also known as the therapeutic community.
And our main guide for this is the excellent chapter in Psychiatric Mental Health Nursing by Townsend and Morgan. It's a really solid resource.
It really is. So our mission for this deep dive, we want you to walk away knowing what milieu therapy actually is, why it's such a big deal in psych nursing.
And crucially, how you can start thinking about using these ideas, these principles, when you become nurses. How you can make the environment work for your patients.
Okay, let's jump right in. First things first. What exactly is milieu therapy?
Okay, so basically, milieu therapy or therapeutic community care, it's all about deliberately setting up the entire environment so it becomes part of the treatment itself.
The whole environment,
Right.
like the building, the people, the schedule.
Everything, yeah. It's about creating this structured, supportive place where every little thing, every interaction, every activity is designed to help people get better mentally.
So it's not just a place where therapy happens, it is the therapy.
You got it. The main goal is to make a space that feels safe, consistent, where people can learn better ways to cope, practice getting along with others, and build stronger interpersonal skills.
Townsend and Morgan have a pretty specific definition, don't they?
They do, yeah. They call it a scientific structuring of the environment in order to affect behavioral changes and to improve the psychological health and functioning of the individual.
Scientific structuring.
Yeah.
That sounds serious. It really highlights that this is intentional, planned stuff.
Absolutely. The environment isn't passive. It's an active tool. Every single interaction, every activity, even just the physical space, it's all purposeful.
Okay, paint us a picture.
Yeah.
How does this look in, like, a real psychiatric unit?
All right, imagine an inpatient unit. There's usually a schedule, right? Group therapy at 10, lunch at 12, maybe some quiet time or activities in the afternoon.
Structure.
Exactly. The staff follow the schedule, the rules are clear. That predictability is super important. Now, say a patient gets upset during group, maybe starts yelling.
Okay.
A nurse using milieu principles wouldn't just shut them down. They might, calmly acknowledge the distress, maybe suggest stepping out for a minute together, offer some coping strategies.
So they're using the moment.
Precisely. They're using that interaction right there in the environment to teach de-escalation, model coping, not just for that one person, but for everyone watching too. The environment teaches.
Okay, that makes a lot more sense. It's about learning in real time.
Yeah.
So what are the underlying beliefs here? What's the philosophy?
Well, a lot of it builds on ideas from behaviorism, like Skinner's work, about how environment shapes behavior. But a core assumption is really positive, that every single person has potential for health and growth.
That's a hopeful starting point.
It really is. And another key idea is that pretty much every interaction, even casual ones, can be therapeutic. It's not just the formal therapy sessions that count.
So like chatting while getting coffee or how people handle sharing the TV remote.
Stuff like that, yeah. Then there's the idea that the client owns their own behavior. Accountability is important.
Right, taking responsibility.
And interestingly, peer pressure is seen as a powerful tool.
Peer pressure, like the bad kind.
Well, hopefully not. More like the group's influence can actually encourage positive changes and adaptive behaviors. Think positive peer pressure, maybe.
Okay, I could see that in a therapeutic setting. Less about bad fashion choices, more about like going to group.
Exactly. And then inappropriate behaviors. They're dealt with right when they happen. It's an immediate learning opportunity.
And it's not about punishment.
No, the focus is much more on constructive feedback, maybe natural consequences rather than, strict restrictions or punishments.
Gotcha. So if the environment is the treatment, what are the essential ingredients? What makes it therapeutic?
Good question. There are several core components. Number one is safety. Physical safety, obviously, but also emotional safety. People need to feel secure to open up.
Can't work on stuff if you feel scared or judged. Makes sense.
Exactly. Then structure. We talked about that predictable routines, clear rules, It provides stability,
Uh-huh.
then support. Staff need to provide consistent empathy, emotional backup, practical help.
Just knowing someone's there.
Hugely important. Also, social skills. The environment provides guided practice for interacting in healthier ways.
Learning by doing.
Yep, and involvement. Clients are encouraged to be active participants in their own care in the community's life.
Gives them agency.
Right. And finally, validation. Respecting people's experiences, affirming their feelings, that builds self-worth.
Okay. Safety, structure, support, social skills, involvement, validation. That's a lot. Where does the nurse fit into all this? It sounds like a team effort.
Oh, nurses are absolutely key. They're often the ones managing the milieu day to day. They're not just observing, they are actively shaping that therapeutic environment.
So what kind of hats are they wearing? What are their specific jobs?
Well, they're definitely managers of the environment. That means organizing the schedule, making sure rules are followed fairly, coordinating with the whole team.
Keeping things running smoothly.
Exactly. They're also huge role models and mediators. They need to show respectful communication themselves, help patients navigate disagreements, and handle difficult behaviors therapeutically.
Setting the tone, basically.
And they're teachers and resources, too, educating patients about emotional regulation, coping skills, health stuff.
Okay.
And, of course, safety monitors. Always assessing risk, making sure the space stays secure for everyone.
Townsend Morgan really drive home how active that role is, don't they?
They really do. It's not passive work at all. The nurse is constantly using the environment strategically.
You gave the example of de-escalation earlier.
Sure.
Any other scenarios where we see a nurse actively using the milieu?
Sure. Let's say you have a patient who's really withdrawn, staying in their room, skipping groups and meals.
Okay, isolating.
Right. A nurse using milieu principles might not just chart it. They might gently approach the patient, maybe during a less structured time, and encourage them to join a simple, low-pressure activity. Perhaps ask them to help set up for, I don't know, an art group.
Giving them a small role, a connection point.
Exactly. It's a small task, manageable, but it fosters that sense of belonging, of contributing.
Yeah.
It might be the first step to them engaging more, feeling less isolated. That's the milieu in action, guided by the nurse.
That's a great example. It shows how those small interactions matter. You mentioned community meetings earlier, too. Tell us more about those.
Yeah, community meetings are usually held daily. They're a really central part of the therapeutic community model.
What happens in them?
It's a chance for everyone, patients and staff, to come together. They might discuss goals for the day, talk about any issues or tensions within the group, give feedback to each other.
Sounds potentially tricky, but important.
It can be, but it's also where a lot of learning happens. Practicing assertiveness, problem solving, listening to others respectfully.
And who leads them?
Staff usually guide the process, but the goal is for patients to take a significant role in leading the discussions too. It promotes autonomy and shared responsibility.
I think the textbook had an example about dishes.
Ah, yes, the unwashed dishes.
Hmm.
Classic milieu scenario. So imagine one person keeps leaving dirty dishes and it's annoying everyone else.
I can picture the eye rolling.
Right. Instead of a staff member just saying, hey, wash your dishes,
Yes.
the nurse would bring it up in the community meeting. They'd facilitate a discussion.
So the group addresses it.
Yeah. The other residents can express how it affects them, maybe understand why the person isn't doing the dishes. Perhaps they're struggling with motivation or something else. Then, ideally, the group works out a solution together.
So it's not just about clean dishes. It's about communication, empathy, problem solving.
Exactly. Learning those real-life skills together.
Okay, now, milieu therapy doesn't happen in a vacuum, right? How does it fit with, like, medication or individual therapy?
No, definitely not. It's designed to work alongside other treatments. Think of it as complementary.
So it supports other therapies.
Absolutely. It works together with medication management, with individual therapies like CBT, with group therapy sessions, family work, OT, recreational therapy, all that stuff.
How does it support them?
Well, the milieu is kind of the testing ground. It's where patients can practice the skills they're learning in CBT or try out new ways of interacting they discussed in group, but in a real-life, dynamic social setting.
So it's where the rubber meets the road, so to speak.
Kind of, yeah.
Yeah.
It reinforces the learning from other therapies.
Okay. Now, you mentioned Skinner earlier. Has this approach changed much over the years? Is it still used the same way?
It has evolved, definitely. The original long-term therapeutic communities where people might live for months or years, those are much less common now.
Why is that?
Mostly due to changes in healthcare funding, insurance pressures, leading to much shorter average lengths of stay in hospitals.
Right, shorter stays are the norm now. So are the principles still used?
Oh, absolutely. The core ideas are alive and well. You see milieu principles being applied in acute inpatient psych units, residential treatment centers, special therapeutic schools, partial hospitalization programs, or PHPs.
So different settings,
Yeah.
but the same core ideas about structure, support, using interactions therapeutically.
Exactly. The big challenge now with those shorter stays
Yeah.
is how to create those therapeutic opportunities efficiently. Staff have to be really skilled at making the most of every interaction, maximizing the therapeutic potential of a shorter time frame. It requires being very intentional.
That makes sense. You have less time, so you have to be more focused.
Yeah.
So boiling it all down for our nursing student listeners, what's the big takeaway for them?
I think the most empowering thing is realizing that you have the ability to shape these healing environments. Understanding milieu therapy gives you the tools to make even brief interactions meaningful and therapeutic.
So it's not just about tasks and meds. It's about consciously creating a space that helps people heal, being like an architect of a healing environment.
That's a great way to put it. Yeah. Every interaction, no matter how small it seems, checking in, offering support, modeling respect, it can all contribute positively when you're thinking through that milieu lens.
Awesome. Okay, ready to put those nursing student brains to the test. Let's do a quick NCLEX-style question.
Let's do it.
All right, listen up, everyone. A nurse on a psychiatric unit is utilizing the principles of milieu therapy with their clients. Which of the following actions by the nurse best exemplifies this approach? A. Providing detailed education to a client about the potential side effects of their prescribed antipsychotic medication. B. Leading a scheduled group psychotherapy session focused on exploring past trauma. C. Actively modeling respectful and assertive communication during a daily community meeting. Or D. Accurately documenting a client's hourly fluid intake and output. What do you think?
Okay, good question. The best answer here is C.
C. Why C?
Because milieu therapy is all about using the environment, especially the social interactions within it, as the therapeutic tool. When the nurse models respectful and assertive communication in that community meeting,
Uh-huh.
they are directly using that social environment to teach and reinforce crucial interpersonal skills for everyone present. That's pure milieu in action.
Okay, and why not the others? A is important, right? Medication education.
Super important, yes, but it's more focused on medication management, not directly on using the environment as the therapy. B, leading a specific therapy group, is a therapy that happens within the milieu, but it's not the definition of the overall milieu approach itself.
Gotcha. And D, documentation.
Essential nursing work, of course, critical for physical health monitoring, but again, it's not about actively shaping the therapeutic social environment in that moment. So C is the one that really captures the essence of using the milieu.
Perfect breakdown. So let's recap quick. Milieu therapy, using the whole environment, structure, interactions, activities, people as an active part of treatment in mental health.
Right. Creating that safe, structured, supportive community where learning and healing happen through everyday experiences and interactions.
And for you future nurses listening, understanding this means you can be intentional architects of those healing spaces. You can make a huge difference.
Absolutely. You really hold the power to influence that environment for the better, helping your patients grow and recover. It's a really vital part of psychiatric nursing.
Totally agree. Well, that's our deep dive for today. Thanks so much for joining us.
Yeah. Thanks, everyone.
And to all you nursing students, seriously, keep going. You're doing amazing work, learning so much. You're going to be incredible nurses. You totally got this.